6 members of the primary healthcare team are assembled for their weekly meeting. The purpose of this meeting is to develop a plan of care for the clients. Present in the meeting are Asha Shani, the psychologist, Hassan Garang, the pharmacist, the team leader and social worker, Nancy Furlong, Sheila McKenzie, the occupational therapist, Kathy Kane, the family physician, and Terry White, the registered nurse.
Good morning. Another busy day for all of us, so let's get started. We have scheduled an hour for today's meeting, and based on what each of you have told me, I have compiled and circulated a list of the clients that we're going to discuss today. I was just wondering, did everybody receive a copy?
Yes.
Okay, and are there any urgent cases that anybody feels need to be added?
No.
Okay. We have been rotating the task of recording alphabetically, Hassan, and I believe you get that honor today.
Does anyone have a copy of the matrix form we are using? Thanks.
Kathy, I know that you and I have been working with Jessica Parsons and her family. Would you like to begin with the presentation?
I've known this family for some time. Jessica's a 16-year-old who lives with her parents and 2 siblings. Her mother brought her in because she's been concerned about her behavior recently. Over the past 3 weeks, Jessica has been worried about everything. She's become more withdrawn, she's not engaging in the same level of activity with her friends, she's irritable with her siblings, and she's complaining of what she says is a bad stomach, with what she describes as cramps and diarrhea. She says she's not been sexually active and her periods are regular, and she's got no history of health-related problems. Jessica's father has suffered from panic attacks in the past and continues to be treated with Paxil. Mrs. Parsons thought that some of Jessica's symptoms were similar, but Jessica doesn't think she's as anxious as her dad, and she was pretty comfortable talking to me about it. I gave Jessica a complete physical and did blood work, all of which was normal. From my initial assessment, Jessica is displaying some of the classic symptoms of a generalized anxiety disorder, but it's early onset, so let's look deeper into this.
Now, I saw this family around 2 years ago, and there were some marital conflicts and some other issues regarding the father's panic attacks and some behavioral difficulties with the eldest daughter. This family does have a lot of strengths, and they really seemed to pull together when they were going through difficult times. Now, when I spoke with Mrs. Parsons, Kathy, she had indicated to me that she had an appointment to see you, and she asked if I would see their family again. Apparently, everyone is worried about the tension, and it's really escalating. The appointment is early next week, and I told her that we would be discussing Jessica at the team meeting today. Kathy, do you have any indication as to why these symptoms of anxiety are happening now? Have there been any recent changes in her life?
She and her boyfriend broke up recently. I initially thought she might be pregnant. They didn't identify any other changes.
How's she been doing in school?
She's remained an average student. She gets B's. She's only missed a couple of sick days so far because of her upset stomach, but I know this is a potential area of concern. I have another appointment scheduled with them for next week, so I will see if the attendance pattern has changed.
Do you think this teenage girl would be a good candidate for the group that Asha and I have been talking about starting? It's about adolescents who have symptoms of anxiety and depression.
Well, she certainly sounds like a good candidate, and the group will take cognitive behavioral approach with anxiety management techniques and education. And often young people respond very well in groups with their peers. And if individual sessions are necessary, then that can be determined as well. And I think further assessment of anxiety would be helpful in this case, and I certainly would see her as well.
Thanks, Asha. I'll recommend that to Jessica. I tend to delay starting medication until after a thorough assessment has been done and other forms of intervention have been tried. So I think that at this point, some group work would be a great addition to the services that we offer. The timing of medication in these situations is an issue. If after further assessment we determine that Jessica needs medication therapy, Hassan, what do you think of the SSRIs with 16-year-olds?
SSR are currently considered inadvisable in this age group due to the reports of increased suicidal thought in teens. However, There is no increased risk of suicide, so they are being used if absolutely necessary. The other options, such as benzodiazepines and TCS, are also problematic. I will get some information together on our options for Jessica.
Now, an issue from earlier that will need to be discussed if medication is started is her father's experience. Although he has continued taking the medication, I know that he has some difficulty just with the idea of having to take it. Now, Mrs. Parsons has been trying to encourage him to cope without it, and this has been a real source of tension between them.
The appropriate use of medication is an area that Terry and I were hoping to address in the group with young people. And Nancy, I'm concerned that I or another psychologist wasn't consulted in this case earlier. And I think a consult with a psychologist would have been helpful for Mr. Parsons.
Yes, that is true. He was seen, I think, on a consult by a psychiatrist who was visiting the region. And Kathy, I know that you were seeing him as well. But he could have benefited from a referral to a psychologist. Asha, you're raising a very important issue. Some of us have worked together for a long time, and of course some of us are new. We didn't always have a psychologist with us on the team, and I know now that you were shared by a couple of teams in different regions, and I believe, Sheila, that's the same with you as the occupational therapist. As our primary healthcare team evolves, we need to learn how to make the best use of our resources. Can you give us some information?
Yeah, since I have just begun this position recently, I think a presentation would be helpful for me to see the possibilities of my role.
I would welcome that opportunity as well.
Well, that's a good idea for our next continuing education initiative. We have talked about the importance of really understanding each other's roles, and we agreed earlier to arrange a presentation on the first Thursday of the month at noon. We haven't arranged for a presenter yet. What does everyone think?
Mm-hmm. That is a good idea. Now, getting back to the plan for this new group that we're going to form, if anyone knows any other young people who would benefit, let us know. Asha and I have discussed it. We've thought of several young people that we thought could benefit.
I co-led a group for adolescents with anxiety issues in my last job, and we offered it at the junior high school. Might be a good idea to talk to the guidance counselor, as it probably be a good opportunity for a joint initiative between health and education. I'd be really interested in sitting in on your planning and discussion as well.
Sounds good. Including more group work has been a goal of this team. It's great to see it starting to happen more.
Well, I agree. And just to clarify the plan we have established for Jessica and her family so far, Hassan, could you please review?
Okay, this is what I have recorded so far. Let me know if I miss anything. Issue 1, further assessment. Cassie, you will see Jessica to follow up on the test you have ordered about bad stomach. You can see what she thinks about to refer Asha to assess her anxiety. Issue 2, medication. Cassie, you will assess and consult with me if education or further information for Jessica and her parent is required. Issue 3, medication. I will check on medication options to treat anxiety for this group. Issue 4, family issues. Ms. Parsons has already contacted Nancy and an appointment is arranged. Issue 5, anxiety management. The new teenagers group may be an option if Jessica is receptive. Asha and Terry are taking steps to set this up and will consult with Sheila about it. I haven't recorded the decision regarding the time frame when a group may begin.
I think that we should have a discussion with the schools, as Sheila suggested, then notify the potential referral sources. We'll report back to the team next week. I'd like to begin sooner than later.
The date for the educational session to be offered by Asha and Sheila is confirmed for the first Thursday of next month at noon.
Thank you, Hassan. Are there any other issues we need to address today regarding Jessica and her family? Okay, so we will discuss our work with Jessica at the next team meeting. Okay, Sheila, I think you have seen the next patient we're about to review. Would you like to start?